workshop. If you've missed Niyah's introduction, we're just going to be using Mentimeter to get some interactive involvement during this workshop. I think we're all probably a bit fed up of just listening to people present without being involved, so we're just going to be able to use Mentimeter to get some interactive engagement, keep people interested, hopefully, through the workshop. So if you follow these instructions on the screen, you can take part in that aspect of it. So if you go to www.menti.com and then enter the code that's shown, that's 63754254, or use a QR code, then you'll be able to respond to the questions we asked throughout the presentation.
And I just wanted to let everyone know that this workshop is being recorded, so if you don't want to be on film, to turn your cameras off, please. Thank you.
Thanks. We could go to the next slide, Niyah. So I think we've hopefully got a few people now, it looks like, that have signed on to Mentimeter. So we're just going to do a test couple of questions. The first one is this is controversial, but what do you call the food item pictured here? Just give people a little bit of time to respond. It looks like we've got a clear winner so far. So we've got 7 coming in at bread roll. I agree with bread roll. Couple cob, couple bap. We've got nobody on batch, which was a discussion we had. None of the above. I'd be really interested to hear what you do call that if it's none of the above. Batch,
it's a pancake.
Brilliant. We should have added that to our list, Niyah. We had this discussion about whether to include batch or not. That's specifically a Coventry thing. So yeah, I'm quite pleased with 7 at bread roll. So we'll just move on to the next slide. Okay, so we're also going to have some word clouds throughout the presentation as well. So here's just an example of how this is going to work. So if on Mentimeter you can just type in what word best describes the weather where you are today. We'll get, hopefully in about 30 seconds or so, a nice image of what it's looking like. It's not looking that nice, but we'll get a picture of what's going on in the country. Cloudy with a chance of M. I'm going to guess is ran out of characters. Murkiness, nice. So it's I'm jealous of the person that's got sunshine right now. It's looking pretty drizzly here. That was my word. Looks like it's quite similar in most places. Okay, if we can just move on. It looks like we've all got the hang of Mentimeter, which is great. So what we're going to be doing in this workshop is we're going to have just a really brief presentation around the work that we've been conducting to increase the uptake of annual health checks for children and young people with moderate to profound intellectual disability. We're going to include into that some interactive elements to the workshop using Mentimeter. And then we're going to finish with a group discussion. So we're going to be talking about reasons for low uptake of annual health checks, as well as some specifics around a model that we've been working on to increase the uptake. Next slide, please. So I think we've skipped the introduction slide, so I'm just going to introduce myself and then go over to Ashley and Niyah, who are also leading this workshop. So I'm Hayley Crawford. I'm an assistant professor at Warwick Medical School, and I work as part within the NIHR Applied Research Collaboration in the West Midlands. And one of the main projects we're working on at the moment is around annual health checks for people with learning disability, and we're specifically focusing on those with moderate to profound learning disability. And we've been conducting this work for a couple of years now. It's been a little bit hampered by the pandemic, but we're in a position to pick it back up again, which is great. So over to Ashley to introduce himself.
Yeah, hi everyone. So my name is Liew. I'm a consultant pediatric neuropsychiatrist, and I work at the Evelina Children's Hospital in South London and Maudsley. It's based down in London. So I work within a tertiary pediatric service, and I see children with a range of developmental disabilities, but have worked within the space around children with intellectual disabilities for quite some time, both clinically and research, and also at NHS England.
Thank you. And Niyah, can you introduce yourself?
Yeah, hi everyone. My name is Niyah Campbell. I'm a PPI lead or public and patient involvement lead, and my role today is to put together this Mentimeter that you're seeing. So this is how I spend my time looking at GIFs and how they can best be used to express ourselves. So hopefully you'll enjoy that today.
Thanks very much. So yeah, looks like you've engaged with this first question, which is great. So this is just to see how familiar you are with annual health checks. We've got one unfamiliar, and then some other people in the middle. We've got some knowledge and then some very familiar. So we'll give a little bit of a brief background for those that are unfamiliar, but it's great to know we've got people that are aware of the annual health check system. Okay, next slide, please. So we know from the existing literature, it's well evidenced that people with learning disabilities have poorer physical and mental health than people without learning disabilities. And this is across a number of domains, so higher unmet health needs, higher prevalence of health conditions, and shorter life expectancy. So to start to tackle this inequality, there's a number of things in place, so NHS long-term plan and NICE guidelines, which both recommend annual health checks to improve outcomes for young people with learning disability. And annual health checks for people aged 14 years or over on their GP's learning disability register are free. So everyone over 14 is eligible for an annual health check of no charge. Next slide, please. So our next question, do you think that annual health checks are effective at improving health? We'll just have 30 seconds or so to just answer this question. Okay, so it looks like most people are not sure. A couple of people that are very optimistic and think that yes, they do improve health. So we'll just, on the next slide, just go to a little bit of the research on this. So research has primarily been conducted with adult populations so far. And there is a general consensus from this research that annual health checks are indeed effective at addressing key health needs of people with learning disability. What the annual health checks result in are increased investigations, increased identification of physical and mental health disorders, increased medication reviews, and appropriate referrals to secondary care. We also know that there's likely then an impact on behaviour in children with learning disabilities, such that painful health conditions that are unidentified can be a cause of behaviours that challenge, like self-injurious behaviour or aggressive behaviour. And so if we're able to identify those health conditions and put the right treatment in place, then that can have a knock-on impact then on behaviours that challenge. But as I said, this research has largely been conducted in adult populations. There is currently little evidence regarding implementation or the impact of annual health checks in children and young people with learning disability. Next slide, please. So our next question, what percentage, this is to the nearest percentage, what percentage of people aged 14 to 17 received an annual health check in 2019 to 2020? Just give us your best guess if you don't already know. So we've got 5 people think 25%, 5 people think 39%, and 1 person thinks 67%. So answers on the next slide. So in 2019, 2020, it was 38.7%. 39% is our closest percentage, so well done for those that got that one. There has been an increase in the last few years. So you can see here these data from gov.uk. This actually excludes practices that don't offer annual health checks, so likely to be an overestimate based on that, but also a likely overestimate given that research indicates that 25% of people, only 25% of people with learning disability are on their GP's learning disability register, and the annual health checks go to those that are on that register. So when we see figures of 39%, actually it might well be a lot lower than that in terms of the overall learning disability population. So you can also see there's a difference here. So the first line on this table shows those that are age 14 to 17, and then the second blue line box shows those age 18 and above. So people aged 14 to 17 have a lower uptake of annual health checks across a number of years than the adult population. Next slide, please. So we've conducted some PPI work to date, so to try to identify some of the reasons around low uptake. So we conducted some focus groups and one-on-one interviews with parents and carers of children with learning disability, as well as 4 children or young people with learning disability themselves, and 24 healthcare and education practitioners from a range of different professional backgrounds. So when we asked parents why they think there is a low uptake, there were actually a number of reasons. Most of them were associated with the challenges of going to the GP itself for the annual health check. So that included things like waiting times being challenging. If there's a long waiting time, people find that quite difficult with the child or the person they care for. But also a lack of continuity of care meant that parents felt that they were constantly sort of explaining their story, as it were, to a range of different professionals, and that it was one more person that they didn't necessarily need to explain that to. Also, unfamiliar people and setting was difficult for families and the people with learning disability in terms of it potentially being a trigger for behaviours that challenge, which was another point that parents raised. They were often taking their child to this setting on their own, and so when they displayed behaviours that challenge, that was particularly stressful for them. Also, there's routine disruption, children being taken out of school so that they can go to the GP, and that was quite challenging. Also, sensory issues. Typically, if you think about a GP surgery, there's bright lights, it's quite often loud voice coming over the tannoy telling you that you're ready for your appointment, and lots of just unfamiliar things in terms of sensory input. And so that can be a challenge. That was a challenge that was reported by families. And then the final one was inexperience of GP. And that was something that came through from the parents, that they felt their GP was inexperienced in sort of dealing with behaviours that challenge or managing those and supporting parents around that. Another reason was that families felt that they often had multiple contacts in terms of secondary care, as well as primary care or specialist intervention teams. So they didn't necessarily feel that there was a need for a separate annual health check, because they felt that a lot of these things were touched upon when they saw their other contacts. Okay, next slide, please. So we also asked healthcare professionals why they thought the uptake of health checks was low. So we're just going to do a quick word cloud here to see what you think they might have said. What do you think healthcare professionals think the reason for low uptake is? So I'll just give you 30 seconds or so to just pop a response in there. It's limited, I think, to 20-something characters, but if you just give us some ideas. Okay, so we've got poor knowledge. I assume that's poor knowledge on the healthcare professionals, sort of not necessarily knowing about the process. Duplication. COVID, yeah, that's a big one. I guess, for the last couple of years. Getting hold of GP. Great. So we're going to pick up some of these in the discussion after we've done these slides. So it'd be great to sort of to chat to you about this and draw out some of that information a little bit more. Capacity, yeah. And no time. Okay, fab, thank you. So next slide, we'll be able to see what they did say. So the main things that came out were that professionals felt that parents didn't know annual health checks existed. So parents didn't ring up and book them because they didn't know that they could. Also, GP surgeries have found it difficult to know who to offer annual health checks to. And then also there was a comment that each practice is only responsible for a handful of people with learning disability, age 14 to 18. So they didn't necessarily feel like they were having a huge influence on those figures. So those are some of the things we'll pick up in the discussion later, because we've been trying to sort of identify ways in which we can overcome these challenges to increase the uptake. Okay, next slide, please. So what we have been working towards is this integration of primary care with other contexts so that we can improve the uptake of annual health checks. We feel that there's a real untapped potential in terms of integration of primary care with education in this sense. So children and young people in the UK benefit from being in an educational system that offer that opportunity to integrate education and healthcare. And so when it particularly comes to annual health checks and increasing that uptake, that opportunity is currently untapped. And what this means is that if we're to integrate those two areas, there is the dual purpose of not just acting on policy in terms of the long-term plan and improving the uptake, but also in SEND reforms to ensure that health information is included in EHCPs. Next slide, please. So this is the proposed framework we put together so far. This is where we're currently at with the work. So we haven't tested this, we haven't developed this to, you know, a huge extent, which is why it's going to be really useful actually, I think, to chat to you about this and get some feedback on it. But we essentially have 4 components to this proposed framework. The first one is around education and is the role of education in improving uptake of annual health checks. So we had just a few ideas from the PPI work that we've done so far. So an example of this would be during the EHCP review, checking that a child or young person is on their GP learning disability register and has been offered an annual health check. So just a really simple sort of record checking exercise, just to ensure that, because one of the reasons was that from professionals was that they didn't know who to offer them to, and you know, we know that not everybody with an intellectual disability is on their GP's learning disability register. So this would just be one way to overcome this a little bit. We've also then discussed with education healthcare professionals some preparation work within schools to prepare children and young people for positive primary care support once they've left education. So the 14 to 17 age range is that tricky sort of time in terms of transition, and so we're trying to build some preparation work to facilitate that transition into this framework. Then secondary care component, we know a lot of people with learning disability will be accessing secondary care, and to overcome some of the challenges identified around GPs lacking in knowledge, as well as literature showing GPs lacking in confidence at supporting people with learning disability. One of the ideas we've had is to for paediatricians to support GPs to administer annual health checks. Now, we don't exactly have a defined way that would happen, and that's what's going to be interesting to come through in some of the discussion points. But just that level of support from people who potentially are more confident and have had more experience in working with people with learning disabilities to support that process. Then in terms of primary care, collaboration with the EHCP review process, as mentioned above, but then also thinking about reasonable adjustments within the GP surgery. So a number of those have been identified from our PPI work that we've conducted so far around sensory input, and there's, appointments being too short, wait times being too long, those sorts of things that can be adjusted within a GP setting. And then finally, a family component where information would be provided to the families about the annual health check process, and also just providing information that can sort of facilitate families going to the GP. So just being aware that they can request for the same GP each time they go, things like that, that will provide education around the annual health check process to the families that need it. And again, that would overcome some of the barriers from the healthcare professionals' point of view that families don't know they exist. So we just had a few ideas really to put that framework together from the PPI work we've conducted. Next slide, please. So what we really want to do with just the rest of this session, which I think there's like 15 minutes or so, is just have a group discussion really about why we think that the uptake is low, what the barriers and facilitators to uptake are, and then any sort of comments that you might have on the proposed framework we've put together so far. This would just really help us, I think, develop this work further to be able to improve the uptake. So Ashley is going to lead our discussion, so I'm going to hand over to you. Thank you.
Thanks, Hayley. So we've got about 15 minutes left. It'd be really great if you could maybe introduce yourself and comment on the kind of questions that you see in front of you. We do have a last slide that has the proposed framework that Hayley presented, and just to think about the different aspects around that. I should just note also that some of you might have noted that there's another workshop that has within its title Annual Health Checks, and that's being led by my colleague from NHS England, Kerry Sykes, who's the commissioner that's been tasked to try and think about priming annual health checks as part of a health improvement process across all of learning disabilities and autism. So I think just to clarify that our workshop is very much focused from a research perspective, how we can try and come up with innovative thoughts and working in partnership with families or other stakeholders to then be proposing either a model that can then be road tested out eventually as part of research funding. So I think that's really where we're coming from. I'm sure Kerry's getting lots of valuable information also about how NHS England, from a commissioning perspective, can be increasing the uptake. Great. So really keen to hear from folk. Go ahead, Rachel.
Hi, thank you. Thanks for the presentation. It's really interesting. I think annual health checks is can be a bit of a barrier for all of us, particularly over the last 2 years. I think we've found a significant drop when we've looked at the data around our annual health checks across Tees Valley. Sorry, I'm a designated clinical officer for Tees Valley CCG. So we cover 5 local authority areas. It's a big CCG footprint. And one of the projects that we're looking at doing, I'm just thinking about the education component of that, is actually, because obviously parents have to take them, but there is a level of trying to raise the awareness and of what a GP is. So I think sometimes the language around GP surgery, GP receptionist, the process to actually get through to a GP is actually a really scary process for our young people. So we've got a small project in 2 special schools where we're actually doing walkthroughs to the GP practice. We've got 2 GP practices on board, and that's really helping to break down barriers, because they're not met with too many words, they're not met with too much language, they're not met with too many sensory impacts, if you like, when you walk into a GP practice. I think the other side of this is that we need to do quite a lot of education with our GP practices. The language that they use is absolutely inaccessible for our young people, and it puts everybody off wanting to get in there, and through no fault of their own, you know, it's just how they speak to people and they're treating them with respect, etc. But it's inaccessible for people, and that's definitely come back on feedback when we've done work directly with children and young people. That's what they've said to us. We don't understand what they're talking about, and therefore we don't want to go anymore. Whereas when we've done the walkthroughs, that's been sort of really useful. We've designed a video using skills for people, so adults with learning disabilities have designed and edited their own annual health checks video, and we've sent this out through our parent mail, our school kind of, our school, the two schools kind of communication system, if you, that they use for parents. And you know like you get a vaccination letter for your children, those of us with kids, that, you know, it's a similar sort of process really, that we're trying to use just to raise the awareness. We can't force parents to go, but also we want to tell them about the benefits of doing it, because I don't think they fully understand that. And actually I think education's the right place to start that discussion, not social care. There's another little project that we're doing with our consultants around getting GPs in virtually on the annual review that they have with children. So we're running the two side by side to see if it increases confidence. So far it has.
Sorry, Rachel, and the annual review meaning when the paediatrician sees the child, or for the whole EHCP review meeting?
No,
right, just when the consultant sees the child, right? Okay.
Yeah, absolutely. We're very lucky to have a consultant that's quite passionate about transitions, and she's led on it. It's quite admin heavy because you have to link in with the GP admin to clock them in. Yeah. And of course, there's a bit of a funding element because the consultant has 45 minutes, whereas a GP has 10 minutes. So you end up having to pay additional for additional session time. So we've had to use some project monies to support, you know, and 10 families essentially is what we've had money for. So it's not a large number, which is often the problem. So, and the other thing that I would suggest is something around having a nurse-led model as opposed to a GP-led model, which we know, I mean, that's fairly common across the patch, I think, but it's not common enough. It's not common enough.
Yeah,
I guess that's all I would have to say.
Well, no, thank you so much for that. And it's really, really heartening because I feel like all of these are points that have come up in our PPI kind of work. So some quick comments. So I think we had also, you know, because obviously when we were running the focus groups, we had conceived this project pre-COVID, but then when we ended up doing the groups, they were in the midst of COVID. And actually, yeah, you know, telemedicine was prime on everyone's minds, and clearly, you know, lots of discussion around how beaming in by video, you know, could be a innovative way forward. We came really quite stuck at the funding issue, which I think you highlighted there. So because this is funded through primary care contracts, and not necessarily a even the kind of tariff-based funding, you know, that we are used to in either CCG or NHSC land kind of thing. It just meant that trying to disaggregate that and then be thinking about innovation, and then how you might then reward, say the school nurse or the school doctor, you know, as you were proposing there with your proposal, was actually quite difficult. And that's terrible, you know, that we can't move forward with innovation just because we've got a stuck bureaucratic kind of like funding system. The other thing which I thought was really interesting was around the kind of nurse-led kind of thing, and both on the side of the primary care practice, and actually we were hearing from some primary care practices where actually it is the nurse, it is the practice nurse that's doing the annual health check anyway. The GP kind of really just does the sign off at the end of it. But also on the school side, so in terms of the special schools, them thinking actually it's the school nurse that's in situ there in the school and really knows the student population well, and therefore a even better place, even though the school doctors, you know, still someone who's very, very knowledgeable about the kind of population. Great, thank you, Rachel. So I think it was Vicky next.
Thank you. Yes, I'm Vicky. I'm the DCO in Rotherham, but I also work part of the week managing children's community health services in Rotherham, and the paediatricians, community paediatricians, come under that. So first of all, thank you very much for doing some work on this, because we've had lots of discussions about it locally, and it feels like a bit of a hard nut to crack. And I think it's felt like a hard nut to crack because of this issue about eligibility, because one of the things that we've hit against is that a lot of our young people who do have, you know, intellectual disability and, you know, including the young people attending schools for children with severe learning difficulties, don't have an official diagnosis on their health record, and unless they've been to CAMS because of challenging behaviour or whatever else, they're unlikely to. And we don't want to overcomplicate and introduce the step of having to have an official diagnosis. So that's one thing that'd be really helpful, I think, to crack. And then the other thing I think is about that interface with paediatricians, and you mentioned that before, because if we've got paediatricians doing quite a thorough annual health check, it's about how does that align with what the GP is doing. So it feels like part of that transitional process rather than a duplication or an overlap.
That's really helpful, Vicky. Hayley, I think we can probably stop sharing. It'd be nicer to kind of all see each other's faces clearly. So the diagnosis bit, and I can see Rachel's put in the chat also that's a significant issue in her area. So it's well recognized nationally. I have been doing some work with the Royal College of Pediatrics, and also so BACD, which stands for the British Association for Childhood Disability. So this is a kind of multidisciplinary kind of grouping around people who work within community pediatric settings who are interested in neurodisability. And I think that there is, I think in general, what I'm hearing is a concern about making a diagnosis of learning disability or intellectual disability, as defined within the diagnostic kind of systems, because of that very traditional definition of having an IQ score, and then also some kind of standardized measure of adaptive functioning. So so typically a Vineland or an ABAS or something like that. Thankfully, the new diagnostic system classification, so the DSM-5 and also the ICD-11, which is meant to be fully operational at some point this year, I mean it's out already, but in terms of an international kind of nomenclature, it's meant to kind of be operational this year. Actually places much less emphasis on the results of standardized tests. Definitely places much more emphasis on adaptive functioning, as described, and they would say describe it within a narrative, not necessarily a standardized test with scores also. So I think there is going to be a shift, I think, that's been sparked off by these diagnostic changes, that I think that we can probably start some kind of education kind of campaign to help particularly pediatricians, but probably across the whole multidisciplinary team within community pediatric services, to start thinking about converting, and I'm sure you're probably used to this, the diagnosis of global developmental delay. That's the kind of majority diagnosis that a lot of these children get, that this is really quite inappropriate, beyond kind of age 6 or 8, and actually you should be defining this as learning disability or intellectual disability. There are going to be a few cases, I would probably guesstimate that to be kind of less than 15%, where actually much more detailed kind of like testing, so with, say, specific psychometric kind of testing or adaptive behavior testing is required, because actually determining the degree of the learning disability is really helpful than in, say, determining a communication intervention or something like that. So so well acknowledged. Thank you. Gemma?
Hi, my name's Gemma. I'm the Assistant Designated Clinical Officer for Norfolk and Waveney. I'll be quick because I realise we're sort of running out of time in a bit, but I just want to say the barrier that I was going to say that we face here is also the diagnosis of learning disability, and we've had quite a few meetings with paediatricians and educational psychologists to try and get a bit of a better system in place, but it's still proving difficult. Both sides to sort of say that's not their place to make that diagnosis, so we're kind of still a bit sort of stuck in that respect. So that, I think that is one of our biggest barriers. But a couple of things that we're doing in Norfolk that are working quite well that we've introduced is the paperwork, annual EHCP annual review paperwork. We have put annual review checks in there in the Year 9+ reviews, and we've put together a pack, like an LD annual review health check pack that goes with the coordinators, so they can give them out at the correct reviews, and it's got like a QR code that then links to local offer website and our Just One Norfolk website, and we've got an animation video on there. So that's really working well, and we've had really good feedback from parent carers about that. And we work with the sort of community LD children's nurses, and they go out to schools and sort of discuss with them about the health checks and what we can do to make it more accessible for them. And we're in the process of designing the birthday card to go out for their birthday, so inviting them to their annual review health check. So that's hopefully going to be done soon. And
that's also a wonderful idea.
Yeah, and we've also had some really good feedback. We've got the pre-health questionnaires that we're encouraging GPs to send out to families before their health check. And the feedback that we've got from that is when families do have that and they are doing that before the health check, their actual health check is much more, I'm trying to think of the right word. It's more productive, and it's going to be looking at the right things because that's already been filled in beforehand. So it's also going to save time as well and just get to the sort of important bits that need discussing. So yeah, so that's kind of what we're doing in Norfolk at the moment.
Oh no, thank you for sharing that, Gemma. And yeah, no, it's really helpful for me to try and think about the national work and try and push on with the diagnosis side of things. Harsh, I'm so sorry that we've run out of time. So I'm just going to quickly read your comments. So we've been engaging with SEN leads across the Midlands to look at how we can more systematically engage SEN on AHCs. Yes, no, that's really good. And Laura, in answer to your question, it is currently only over 14s. I guess the alternative is actually just community pediatric reviews for under 14s, which the reason for our proposed model was because actually when you look at what a community pediatrician does with most children with disabilities, it's actually much more comprehensive than the annual health check, or certainly if you look through the annual health check paperwork, what that would cover. But obviously, I'm sure there are primary care providers that go way beyond kind of what's written within the actual checklist. So I think that's where our idea birthed, came from. But yeah, just to say that it's not as if that it's a black hole. In fact, if anything, that's actually quite a good service for under 14s with neurodisabilities from pediatricians. So thank you everyone for your contributions. I'm conscious that we're at the end of the allotted time. Is that right, Garling? You're right. Okay, yeah. And then I think, is there a 10-minute break before people join the next workshop? Yep. Okay, right. So on behalf of Hayley, Niyah, and myself, thank you so much for your contributions. It's been extremely valuable. I think this is really going to help us think about how we can try and take some of this work forward. And I will try and find a way that I can try and keep a record of your names so that I know that diagnostic issue seems to be quite a big feature in quite a number of your areas. So I will try and maybe try and email you guys an update as I progress with this. Thank you, everyone. Have a good afternoon.
Thank you. Bye.